queens and kings that run everything, and then there's everybody else. I'm coming in hot.
Hey everyone, I'm bringing this story to you today because I want to prepare you for the third wave of the coronavirus. A woman with HIV had the coronavirus for 216 days. The virus mutated inside of her body at least 30 times, studies show. It was told that a woman living with HIV was doing a study. The study was about seeing how the COVID virus affected those who already had an immune deficiency, such as HIV or AIDS patients. When they looked at the study, 4 of the people living with HIV had the virus for days and months past the days that it was supposed to develop and leave your body. Basically, they're saying that the virus stays in your body no more than 2 weeks. This one woman had it for a month, which was a red flag, and the virus mutated into different strains of it. And that's what's going to give us a third wave. The other woman, she had it in her body for 216 days. When she went to the doctor, they let her know that she had mild symptoms of coronavirus, but they didn't know that it was mutating inside of her body over 30 times. And they basically came up with different strands. So I noticed on the internet, a lot of people are talking about the alpha and the beta males and the alpha males. Okay, well, the E484K mutation is a part of the alpha variant, B117, which was the first seen in UK. The N510Y mutation, which is a part of the beta variant, B1351, was first seen in South Africa. If more cases are found, it raised the prospect that HIV infection could be the source of all new variants, simply because the patients can carry the virus for longer and it can develop into different strands, such as those 2 that I just named, but the lady came up with 30 in her body by having it for so long living inside. So there could be 30 strands of coronavirus out here affecting people, and they're trying to say this lady isn't the source, but they're trying to say patients living with HIV could be the source of the mutation of the disease. It prolongs the infection and it requires immune compromise, the doctor said. The woman in this case, she was immune suppressed. This case could easily have gone unnoticed if she hadn't went to that study to see how was people with HIV living with coronavirus. It would have just doubled and tripled like it had been doing for the 216 days that she had it. So that is something very serious. It says only one other case of a person with HIV carrying the coronavirus for a long period of time had been published previously. Other than that, no one has spoken of the people living with HIV, how this virus is mutating in their body and it's causing the different strands of the virus. So the finding could be of a particular importance for people in Africa, which have about 26 million people living with HIV as of 2020. The WHO on Friday warned that the sharp rise in COVID cases could turn into a continent-wide third wave of COVID. And if they travel or we travel to them or whatever, we could not only catch the COVID-19, but the alpha carrier of the COVID, the beta carrier, and then so on, and 30 more. So I hope you all have heard what I just said and be on the lookout. Be safe out there. Be careful. But they're talking about a third wave, and they're talking about it's the people who are living with HIV that has the coronavirus, or the virus is mutating inside their body, and that's where these new strands are coming from. And even if you never believed in the coronavirus, if they had given this thing to one person with HIV, it could become something of its own, and they can call it coronavirus or whatever, but there's different strands of it that could reproduce if it stays in your body longer than 2 weeks, and that's a problem. Thanks for tuning in. I'll see you next time on As the World Turns News.